how I want it to be. Anyway, free health services basically means that we are providing essential health services free of cost to the targeted population, and universal health coverage, Dr. Tirtharana has very eloquently described to us. What is the context? We have the National Health Policy, which is based on the principles of primary health care with emphasis on services which are acceptable, affordable and available, especially to people in remote areas. We have the second long-term health plan, which made essential healthcare services, which are committed to making it accessible to all people. We have the health sector strategy in the form of Nepal Health Sector Program 1, 2, and now the third one, which is being drafted, which focuses on strengthening the system and providing affordable quality services to all in a staggered manner. In 2006, emergency and inpatient services were made free for the ultra-poor, the destitutes, elderly. The services at the district hospital was also made free for the group that I mentioned earlier. And as you may know, that between 20 to 40 and now recently it's been increased to 60, drugs are also available free. Mr. Ambassador, as well as Dr. Rana, this is the NMIS as well as other reports combined, and stock out of essential drugs continues to be a problem. So I come back to where we started, that though we've come a long way, but there are serious challenges regarding access to services. There is inadequate infrastructure and technology. Human resource management is an issue, and especially production, deployment, retention. There's a tremendous challenge of brain drain in the country. All those affect how the services are being delivered. There is problem of emerging diseases and non-communicable diseases. On one hand, we are grappling with the problem of undernutrition in children and women, and on the other hand, I think 14% of Nepali women are obese. Our preparedness for epidemics and natural disasters limited. There are emerging threats like climate change, new diseases coming up, aging, and the demand is only going to increase with increasing population, ever more sophisticated and expensive technologies. So, our needs are infinite and the resources are limited. So what do the above realities mean for universal health coverage? The coverage, and cover everybody. Similarly, we need to enhance the package of services that are being delivered and also reduce the cost. Basic prerequisite being that there is a strong system, affordable, and access is ensured, and there is capacity of human resources available. Can I have some water, please? Costs and coverage and insurance. However, I really feel that we need to first look at our strengths. We need to look what exists, what is health, instead of services. We need to invest on health education and to promote healthy behaviors. We need to prioritize clinical services that are most important, like immunization, family planning, antenatal care, ensuring institutional childbirths. As I mentioned, there's an enormous problem of those who are still far from services, be it due to geographic inaccessibility, be it due to poverty. We have a problem of caste-based seclusion. Women are marginalized. We need to look at all this. And I'm pleased to share at this stage that Ministry of Health is proactive and is drafting the strategy for reaching the unreached. We need to partner with private sector. That is one area we haven't. There have been some initiatives, but I consider it an untapped resource. We need to really look at the structural and regulatory approaches, such as tobacco taxation, clean air, road safety. We need to direct research towards the strong drivers to ensure food and nutrition security, how we could develop high-impact innovative approaches like less polluting cooking stove, and what are the interventions that would cause impact in the world that we can do it. And I really, it is my humble request that we approach universal health coverage looking at our contextual realities, build it to wrap it up.